Hi, my name is Michael. I'm here with fsimon Medical, and we're going to demonstrate the Medtronic ENT fusion system. We're going to do a quick walkthrough and an overview of functionality, and then show you the nitty-gritty. First thing, we have our patient exam already loaded. We'll step forward and set up the equipment. First thing is the patient tracker gets plugged into the module here, into the front of the unit. And then our registration probe is going to go into the second port. From this point, we step forward into the registration where it says register. We place our head frame on the front of the patient, and then we place our emitter within the correct proximity of the patient's head. There's a bed rail clamp that can be mounted to the side of a bed, or the system can stay on the cart and point at the patient's anatomy. So whichever is easiest for you, that's what we'll do. So to register, we're going to take the registration probe, place it in the divot on the patient's forehead. You'll hear a confirmation tone. Once you hit that, hit the next key. You'll get a 3-second countdown to begin the tracer registration. Once you get the countdown, begin tracing the topography of the face, staying on bony anatomy and avoiding fleshy materials. Once enough points have been collected, you get confirmation, and we can step next again and validate our accuracy. Check known anatomy, lateral canthus, medial canthus, tip of the nose, right lateral canthus. Check the acoustic meatus, or any other known topographical landmarks that we can utilize to verify our registration. Once our registration has been validated, hit the next key, and this will take us into our navigation screen. For this particular model, we used a tumor demo, and you can see that within the tumor demo, we can actually touch the anatomy. I'm going to go through and validate the other instrumentation and demonstrate that and make sure that they function appropriately. So now that we've used our registration probe, we want to attach another instrument. To do that, we take the tracker off of the instrument and select another. In this instance, we'll use a 90-degree suction. Place the tracker on, and to validate the instrument, we place it in the divot. You'll hear a confirmation tone that says it's been validated, and now we can navigate utilizing that instrument. In this instance, you'll see I can go up the nostrils, or again, the acoustic meatus, point to the lateral canthi, medial canthus. On the contralateral side, and navigation tracks throughout. We'll point to our little tumor on the side of the head here. And validate all aspects of that anatomy. If we want to switch again, you can either utilize multiple trackers on multiple instruments. We have 3 additional ports, including the patient tracker, which makes number 4. Your patient tracker should always remain your top one. Never remove that. For the next one, we will pick, we'll do the ostium seeker. For this one, we're going to validate the ostium seeker. Same process. Place it in the divot on the patient's forehead. You get your confirmation tone, and you'll see that that changes on the screen there. And again, we can navigate accordingly. Left lateral, right lateral, nasion, glabella. So navigation is fully functional. For this part of the demo, we're going to utilize the M4 handpiece. This is the RAD 40 connected to the Fusion. Again, We add it to our port. The RAD40 is already verified, so there's no need to validate it in the divot. Once it's plugged in and the system recognizes it, the system will track automatically. Left lateral canthus, medial canthus, right lateral canthus, tip of the nose, and so on. All functionality of the handpiece is fully operable. So you have suction, you have irrigation attached to it, just like a normal M4, except it's tracked.